Thank you very much, and good evening, ladies and gentlemen. It's always an unenviable position to be standing between the podium and people's meals. And for those of you who are now wishing you'd had those little shots of soup beforehand, settling, I have about 90 minutes of prepared remarks. I hope that's okay. I was told when I came in, I was given a little bit of background, and I was told, you know, this is a Catholic organization. I wasn't sure why I was told that. Maybe, you know, Goldbloom was a bit of a tip-off, and then, of course, the next person I met was Shirley Abramsky. So I could see this is a profoundly Catholic organization. And I, you know, was racking my brains for something vaguely Catholic to say. As part of my remarks, all I could think of was under the B5. And let me say, first of all, it's a great privilege for me to be here this evening. And it's a privilege at multiple levels. Firstly, as a practicing psychiatrist, when there's an opportunity to try to support and promote the needs of people with mental illness and their families, I want to be there. As a member of the Mental Health Commission of Canada that's got a mandate to work on this problem over the course of 10 years, it's a privilege for me to be here. It's also a privilege for me to be here as a family member of a number of people who've experienced mental illness, including a couple of physicians in my family who died by suicide as a consequence of mental illness. And finally, as a Canadian citizen, because this is ultimately an issue of citizenship, of rights, of how we care for people when they're at their most vulnerable in our society. However, when I was told that I should be speaking about stigma and its history, this was the ultimate Coles to Newcastle exercise, because I was very mindful of two people. Number one, Heather Stewart, who's been appropriately honored with a Bell Canada chair that is the first, to my knowledge, anywhere in the world in stigma research. And I'm both delighted and daunted that she's here this evening. I did explain to her I was going to take all of her work and claim it as my own during my remarks. I'm also very happy to be seated next to Jackie Duncan, the Hanna Professor of the History of Medicine, no stranger to the history of various aspects of medicine, including mental illness. I was the subject of a rather somber photograph in the Globe and Mail yesterday. For anybody who saw it, it looked like black smoke was coming out of my ears, but I was in fact standing in front of a painting in a very unfortunate position. And I try to smile more often than that photograph would suggest. But I want to take you back to an earlier edition of the Globe and Mail, one that appeared on April 5th, 1890. And it was a front page story of the Globe and Mail, not buried on page 9 like I was. This was called At the Asylum, a visit to a great institution, April 5th, 1890. And this is how this very long full-page article began. Insanity. Does not the word bring to the recollection of almost every reader some face, a friend, a relative perhaps, of one who, though living, is counted among the dead? What sad chapters have been written in many a family history, and must be written until the end of time, bearing that terrible title, Insanity. Where is the mind so inflexible as to view undisturbed, or the heart so adamantine as to pass without sadness the tomb of the living dead? And that description was of the hospital where I work today, the tomb of the living dead. And for people who grew up in Toronto, I did not, that hospital had many names. It started out in 1850, just before the Rockwood Asylum, in fact, as the Provincial Lunatic Asylum. It was not considered a term of derision. Nobody knew what caused mental illness. P.S. Nobody still knows. And it was named that way, I think, out of the best of intentions of the time, and around the idea that asylum still had a benevolent concept, as it does in the political realm today, but no longer in the medical realm. In the political realm, asylum means your rights are protected. There is somebody looking after you, caring for you. But when we talk about asylum in the medical context, unfortunately, its long history is now relegated to a bygone era of custodial care, obscuring the humanity that undoubtedly existed among the men and women who worked there. And over the years, that hospital's name kept changing because trends kept changing. They thought, well, Provincial Lunatic Asylum, you know, that's a little rough. Let's change the name. I know, the Toronto Hospital for the Insane. So that's what it became. And then somebody said, gee, you know, I'm not quite sure. Then it became the Ontario Hospital, bracket for the insane, close bracket. And then in its final burst of glory, it became Queen Street Mental Health Center. But of course, you had to have a mental illness to get in the door. And now, of course, it's part of the Center for Addiction and Mental Health, a name that doesn't really convey necessarily that it's a hospital, that it's the largest psychiatric hospital in Canada. And in my view, there's only one honestly named hospital still left, and it still has its name because of the brand equity associated with it. It's the Hospital for Sick Children. Nobody today, if they were building that hospital anew, would call it the Hospital for Sick Children. They'd call it the Children's Health and Wellness Center, right? But it, again, obscures the fact that you need to be a child and you need to be ill to get in the door and certainly to stay there. So this is the history, if you will, of our attitudes toward people with mental illness. When CAMH was built as the Provincial Lunatic Asylum, it was built on the outskirts of Toronto. In fact, it was outside the city limits. It's only an accident of urban sprawl that it now finds itself on a 27-acre plot in the heart of the hippest area of Toronto. I'm actually too old to go into any of the restaurants immediately surrounding the hospital. And of course, within 8 years of the lunatic asylum opening, the Rockwood Asylum opened here. And this led to a very interesting and hotly debated topic in the 19th century of visiting at the asylums. And there's a wonderful book about prisons and asylums and institutional visiting in the 19th century in Canada that was just published last year. And in fact, in 1871, the superintendent of the Rockwood Asylum here in Kingston complained that, quote, a great many people feel a good deal of repugnance to lunatic asylums. This feeling is in great measure attributable to the part that the public are not made sufficiently acquainted with the workings of those institutions, and they encouraged visiting. In fact, tickets of admission were sold to the asylums. And the debate was always, were people going to learn more in terms of public good, or were people going to gawk at the mentally ill? And I can tell you, I think, from my reading of things, both were at play. There was a huge debate over whether this was informative or exploitative. For instance, at the Rockwood Hospital, there's documentation of a woman who believed she was Queen Victoria. And when visitors would come, she would rush to her room to be in stately repose to greet them. And they would bring trinkets and gifts to her, nourishing this grandiose delusion that she was indeed the queen. Was that informative? I doubt it. But remember, this was all occurring against a backdrop of a time now too quickly forgotten, when we had no effective treatments for the major mental illnesses, schizophrenia, depression, bipolar disorder. We're in a lot better shape now, but we're still nowhere where we need to be. So I want to turn with some trepidation to the subject of stigma. And I can feel Heather Stewart's eyes staring at me intently, actually going right through my cranium. So what is it? Well, it's the situation of the individual who has been disqualified from full social acceptance. How many of you here saw the film My Big Fat Greek Wedding? Okay, a good number of you. Now, if you cast your mind back to that film, you'll remember that Nia Vardalos' father, who was a very proud Greek, as are so many Greeks, a very proud Greek, he believed that every word in the English language came from Greek. He also believed that Windex cured all skin lesions. He was always spraying himself with Windex. But he had tremendous pride. You know, I'm actually quite jealous of the ethnic pride of the Greeks, because in Toronto, where there's a large Greek community, the restaurants are the friendly Greek, the neighborhood Greek, Mr. Greek. Right? And I keep thinking, if I were to drive into the Jewish quarter of Toronto to see the friendly Jew, Mr. Jew, the neighborhood Jew, it would never happen. But, you know, the Greeks are still appropriately proud of their heritage and culture. Anyway, when it comes to the word stigma, he was correct. The word does emanate from Greek, and it refers to those bodily signs that are designed to expose something unusual and bad about the moral status of a person. This is a blemished person, someone ritually polluted, someone to be avoided in public places. And that's the sort of horrible etymological origin of a word that still has tremendous power in 2012 in terms of its translation into behavior. And the translation into behavior is not stigma. The translation into behavior is discrimination. Now, at a more conceptual level, what really is stigma? Well, it's an inescapable consequence, in some measure, of our humanity. Because what do? We order the universe by setting ourselves apart from other people. There is always the other. And our fragile sense of who we are as individuals can often be reinforced by pathologizing other people. Sometimes it's very adaptive, like in war. To be able to pathologize the enemy allows soldiers to fight. You know, when there's a truce, like in World War I, when they had the armistice on Christmas Day, it was devastating for soldiers. How could they go into battle with people with whom they had broken bread? The great medical historian, late great medical historian, Roy Porter, he was the greatest historian. Now that he's dead, it's Jackie Duff. He said, to set the sick apart sustains the fantasy that we are whole. Now, there's something specific around the stigma around mental illness, because mental illnesses have unique properties that physical illnesses don't have. They express themselves through the way we think, the way we feel, the way we act. The very same dimensions that define us as individuals, which makes it a whole lot harder to separate the illness from the person. But it's something we must do. The other reality of stigma is that it has its benefits. And I say that with some trepidation, but allow me to explain. There are critical elements of stigma that are actually beneficial and necessary for human survival. The first is the ability to discriminate, the ability to identify differences. If you think about it, if you're walking along a path and you hear a purring sound, and you say, well, that's a member of the feline family according to my ears, but you can't distinguish between a tabby cat and a cougar, you've got a very short lifespan ahead of you. So that ability to discriminate is essential. Similarly, the ability to identify commonalities across individuals, across groups, is a very important skill. And finally, what we do every day, especially in the Twitter universe, is the ability to form global impressions based on very little information. Now 144 characters or less, and people think they've learned something. But the trade-off for expediency and safety is prejudgment and bias. And in our politically correct universe, there is only really a handful of groups left that our culture permits to stigmatize, to lampoon, to make fun of. And chief among those are people with mental illness. They remain the object of derision, of jokes, of castigation, and of avoidance in ways that would never be tolerated for physical disability, for ethno-racial diversity, for faith, for any other dimension that you want to conceive of. And you merely need to turn on your television, or open the New Yorker, or look in your daily funnies in your local paper to see that derision in place. If you look at psychiatrists and their patients in cartoons, and somebody with too much time on their hands actually did a research project based on half a century of New Yorker cartoons, looking at the way people with mental illness were depicted. And what was the scenario? Always the same. There was a couch, of course. There was sitting behind the couch, usually a balding, middle-aged male psychiatrist with large horn-rimmed glasses and a goatee, a large notepad and a pencil, and usually a woman lying on a couch. And one of the two of them is saying something ridiculous. It doesn't matter which one. Could be the psychiatrist, could be the patient. What purpose does this serve? Well, I think the purpose that it serves, because humor is powerful, I'm a complete and utter believer in its value. The purpose it serves is to trivialize the threat that mental illness represents. Because nothing threatens our sense of who we are, who our family is, than mental illness. And all the more reason why the response needs to be galvanized. The asylum that was here, the Rockwood, the asylum in Toronto, the lunatic asylum, were part of a phenomenon that swept across North America in the 19th century, and in fact took over a responsibility that was largely assumed by families. And what led to that change? Well, there was a shift to a service economy. There was consumerism in the 19th century. There was also the reality that for many people their workplace was now very different than the place where they lived, and they had to travel. And looking after a mentally ill person at home no longer became as feasible for families. And finally, there was the professionalization of the treatment of mental illness in asylums. It was really, in many respects, the birthplace of psychiatry, and it was a place that promised cure. These large asylums often boasted of their ability to cure people of mental illness, and frequently listed among their benefits the therapeutic removal of a person from their family. And, you know, for the people I've spoken to who lived in Toronto growing up, they knew the asylum where I worked, not by its name, but by its street address, 999. And I see some heads nodding here. And what they told me is that they were told as children by their parents, you finish that broccoli or we're sending you to 999. And the implication was if you went in the front door, you never left. And indeed, you know, lots of people left asylums, particularly if they had self-limited illnesses like depression. If they had illnesses that were chronic, like schizophrenia, there was a greater chance they might live out their days in the asylum and be buried in the asylum graveyard. And if they died by suicide, as is such a significant risk for people with schizophrenia, bipolar disorder, and depression in particular, across a number of faiths, their suffering could not even be acknowledged in death in terms of religious burial. And that, to me, does not reflect well on all of our faiths in terms of compounding the shame, the suffering after death. And we see it even in the obituaries, even today in 2012, where the code remains died suddenly. No charity is named. No cause is given. We can do better than this. We can honor people for the struggles that they face with schizophrenia, with depression, with bipolar disorder, even when it culminates in their death by suicide. Now, I have no idea how long I've been talking. How long have I been talking?
Oh, you're not there yet.
I'm not there yet.
Yeah. 80 more minutes.
Yeah.